I received a phone call for a consultation from an Asian mom who was calling to get plastic surgery for her son. She said that he wanted an extra crease of his eyelids. So when I asked her just how old he was, she replied, 8. Yes, she was calling to get plastic surgery for her son who was only 8 years old. On this video, I'm going to get to the bottom of Asian plastic surgery from me, an Asian plastic surgeon. And this includes the disturbing history behind these procedures and the dark side of plastic surgery in Asia that you may not know about. And we're going to tackle these two very important questions. Are we going too far with Asian plastic surgery? And is plastic surgery being performed on Asians meant to make them look more Caucasian? According to the International Society for Aesthetic Plastic Surgery, the United States and Brazil are the number 1 and number 2 biggest exporters of plastic surgery. Number 3, 4, and 5, though, are China, Japan, and South Korea. In fact, a whopping 20% of all women in South Korea have had cosmetic surgery. In 2014, Asian eyelid surgery, that double eyelid surgery I mentioned earlier, was the 4th most popular plastic surgery across the world. In Asians, it was number 1. So what started the boom in plastic surgery amongst East Asians? Although double eyelid surgery was first introduced back in Japan in the 19th century, it was only after the Korean War that Asian eyelid surgery and Asian plastic surgery in general became really popular. Now, approximately 50% of East Asians have a double crease, a natural crease of their upper eyelid. The other 50% have monolids, like me, where I do not have an extra crease of my upper eyelid. The surgery to create this extra crease was developed and popularized by an American military plastic surgeon named Dr. Ralph Millard. Now, he's become since then a legend in the field of plastic surgery. He has had textbooks, he's had procedures, and even instruments that have been named after him. Dr. Millard was stationed in South Korea during the Korean War in the 1950s. And at that time, he was performing reconstructive plastic surgery on soldiers who have been injured and cosmetic plastic surgery on Korean women. Yes, you heard that right, reconstructive surgery on soldiers and cosmetic surgery on Korean women. Now, among the first people to undergo Asian eyelid surgery, where we create an extra crease in a patient with a monolid, were the Korean brides of the soldiers back during the Korean War. The War Brides Act of 1945 allowed American soldiers to bring home wives from the different countries that they may have been stationed at overseas. And this was even though interracial marriages were banned throughout parts of the country until the landmark case Loving versus Virginia back in the 1960s. But the problem was that many Americans, including Dr. Ralph Millard, believed that the appearance of a natural Asian eyelid, the monolid, produced, in his words, a passive expression which seems to epitomize the stoical and unemotional manner of the Oriental. Essentially, he considered Asian monolids to be unattractive, threatening, and too foreign for the Americans back home. He believed that by changing the Asian eyelids to look more and more like Caucasian eyelids, to open them up more, would allow them to more easily assimilate into the American society. So he did what many other plastic surgeons would probably do. He surgically altered the appearance of the Asian eyelids to make it more acceptable to the Americans. Now, these plastic surgery techniques and principles that Dr. Millard created and popularized have now formed the basis for a lot of the Asian facial plastic surgeries that are being performed today. And it's not only plastic surgery of the eyelids that's really popular amongst Asian patients. The number 2 most popular procedure is rhinoplasty. In this operation, the nose is made to look more narrow and more projecting, less resembling a classic Asian nose and more resembling, you guessed it, a Caucasian nose. Skin lightening using topical treatments and creams, along with IV treatments like glutathione, are also very popular among East Asians. And this is a way to cause the skin to look more and more white in appearance. Now, full disclosure, I am a real plastic surgeon, and at the beginning of my practice, I did perform a handful of Asian eyelid surgery and Asian rhinoplasty operations. I really didn't think about any ethical issues that I really had at that time with these operations, but after performing a handful of them, I really started realizing that they are not for me to perform. And 2 events especially cemented my decision to no longer perform these procedures. First, I had a friend of mine who was told by her mother at a party that she was ugly and needed to get her eyelids and her nose done, and that she should fly to Korea to get them fixed up. I could not believe what I was hearing, that a mother would say this to her own daughter, and I could see the hurt in her daughter's eyes. And the second event was that my wife and I had a daughter of our own. Now, if you follow me for a while, you may know that my wife is Caucasian, and as you know, I am Asian with a monolid. And when our daughter was born, she also was born with monolids, and she continues to have them to this day. And the thought that she would ever think that she needs eyelid surgery to look beautiful is an absolutely horrifying thought to me. When I saw her the day she was born, I knew she was the most beautiful girl I'd ever seen in my life, monolids and all. And although this is completely unrealistic for me to think, I wish for all Asian women who have monolids to never feel that they need to have plastic surgery in order to look and feel beautiful. Now, I need to say that I don't judge plastic surgeons or patients for either performing these operations or having it done to themselves. It is your life, and I truly wish you the best in whatever decisions you make for yourself. But I believe the key here, the big key, is you should do it for yourself. And unfortunately, it is just not that simple. Society has been telling us for decades that looking quote-unquote Asian is not necessarily attractive. And this has not only happened and happens here in the United States, but in Asian countries as well. And my wish is that people all around the world would see the beauty in all types of people, plastic surgery or not. Now, it's not only plastic surgery that has been skewed in favor of the Western appearance. A lot of skincare recommendations that you see online and on social media are based off of people with lighter skin tones. But what if you have darker skin? What should you do in that case regarding your skincare? Well, I have created a video right up here that gives my 7 do's and don'ts regarding skincare if you have darker skin. So if you're African American, Latino, Latina, Asian, or anything else, if your skin is darker and you want my 7 do's and don'ts, take a peek at the video right up here. And remember, eat real food, use clean skincare, and always wait before you operate.